The question of why populations in lower socioeconomic brackets, including those living in poverty, tend to have larger families is multifaceted, touching on economic or sociocultural factors. It's crucial to approach this topic with sensitivity and awareness of the complex interplay of circumstances that influence reproductive choices and outcomes. In many developing countries and impoverished areas, having more children can be seen as a way to ensure economic security in old age. This is because, in the absence of adequate social security systems, parents often depend on their children for support during their elderly years. In some contexts, having more children means more hands to work, be it in agriculture, family businesses, or informal sectors. This can be a short-term economic strategy to increase the family's income or manage subsistence farming needs. In many societies, large families are culturally valued. The desire for male heirs can also drive higher birth rates, particularly in cultures where sons are preferred for reasons of lineage, inheritance, or social security. Traditional gender roles and the status associated with marriage and childbearing can also influence family size. In some cultures, women's roles are closely tied to motherhood, and their status within a community or family can be linked to their ability to bear children. There's a strong correlation between the level of education, particularly female education, and fertility rates. Lower levels of education limit awareness and access to family planning information and contraceptives, leading to higher birth rates. When women have greater access to education and employment, fertility rates tend to drop. Education empowers women with knowledge about health and access to family planning services, and employment provides an alternative avenue for women's contribution to the economy besides childbearing. Poor access to quality healthcare services, including reproductive health and family planning, contributes to higher fertility rates. Lack of access to contraceptives, prenatal, postnatal, and general healthcare leads to more pregnancies and higher birth rates. High infant mortality rates can influence family size. In areas where infant mortality is high, families might have more children, anticipating that some may not survive to adulthood. In contexts of high mortality rates or economic uncertainty, having more children can be a strategy to ensure that some survive to adulthood and can contribute to family welfare. Children can also represent social capital, strengthening ties between families and communities through marriage or social networks, which can be critical for survival in challenging environments. In some cases, government policies or the lack thereof can influence birth rates. Urbanization tends to be associated with lower birth rates due to higher living costs, greater access to education and healthcare, and different lifestyle choices. Understanding why poorer populations may have larger families requires a holistic view that considers economy, cultural values, educational opportunities, access to healthcare, and government policies.